I'm Jack Guillory, former wrestler, Army paratrooper, and exercise scientist, now a PA specializing in men's health and sexual medicine. I've had the honor of learning from some of the best. Now I'm here to use the lessons I've learned to help you maintain your health, performance, and vitality. This is Strong and Hard. Today's going to be a hot one. I'll be covering my testosterone therapy tier list, what works, what doesn't, and what are my favorite options for my patients. With plenty of good products on the market, making a decision about what the right therapy is for you is mostly based on personal preference. But there are other factors we need to consider. It's a complex decision that you need to make with your healthcare provider. With that being said, I do this every day. I'm very familiar with the different products and the experiences my patients have had with them. I'll present you with some information today as well as my opinion on the different products. You can take that information and make an educated decision for yourself. Products will be ranked on the list based on 4 different criteria: affordability and insurance coverage, effectiveness, convenience, safety, and side effect profile. So, let's get started. Number 1 on the list is the classic testosterone injections. Typically, we'll be using testosterone cypionate or testosterone enanthate. These two esters are very similar and have a difference in half-life of about 1 day. They're virtually interchangeable. We favor testosterone enanthate a little more for older gentlemen as it causes a little less fluid retention. These medications are cheap. Without insurance coverage, you can get them for about $20 to $30 a month from a compounding pharmacy, and they're very commonly covered by insurance. The injections can be done easily by yourself at home once or twice a week. Twice a week is most optimal, and once a week is good enough for a lot of people. The more frequent the dosing and the smaller the dose, the more stable levels you'll have. An interesting tool I like to use is steroid plotter. This application will allow you to plot a graph of your dosing regimen. It will then give you an estimate of what your levels will be at peaks and troughs. As seen here, once a week is pretty stable, and twice a week is much more stable. Very little fluctuation in levels, and this usually leads to less side effects. The other advantage of testosterone injections is that the dosage is easily adjusted on the fly. You simply draw up a little less or a little more into the syringe for your injection. The injections can also be done either intramuscularly or subcutaneously. Because this form of testosterone therapy is a little more potent and longer acting, side effects are more common. However, they're mostly pretty mild and easily controlled. The most common side effect we see is an elevated hematocrit or blood count. Testosterone stimulates red blood cell production, and some men will produce too many red blood cells. If this happens, you're at a theoretical increased risk of blood clots. We're very careful about this, and so we monitor the blood work. If your blood count gets too high, we ask you to go donate some blood to get rid of some red blood cells. The other most common side effect is an elevated estrogen level. Testosterone is converted into estrogen in your body. Some men convert more testosterone than others, and their estrogen may get too high when we raise their testosterone level. If this occurs, we can control it with a medication that just simply lowers your estrogen. Estrogen's not bad, you need some for good health and sexual function. But we don't want the estrogen level to get too high, or it can cause side effects such as gynecomastia, mood changes, and swelling in the hands and feet. Overall, testosterone injections are extremely effective, affordable, pretty convenient, and very safe. I place them in S tier. Second on the list is Xiosted or testosterone enanthate autoinjectors. These autoinjectors are very convenient and are effectively the same thing as testosterone injections. Specifically, they use the ester testosterone enanthate. They come prepackaged in a convenient autoinjector that most people say is virtually painless to use. They're administered subcutaneously once a week, much like the standard injections. Insurance coverage has gotten better for these products, but they're oftentimes not covered. If you don't get insurance coverage, you can pay out of pocket for them, and the manufacturer discount price is about $175 per month as of January 2025. Aside from the price, the other disadvantage of these is that they're not as adjustable. They come in 3 different dosages: 50 milligrams, 75 milligrams, and 100 milligrams. Insurance will only cover for 1 autoinjector per week, so you're somewhat limited in the dosage adjustment. However, this is usually not that big of a deal and works well for most people. Overall, there are very few downsides to the Xiosted autoinjectors, and they're one of my favorite therapies. Therefore, I place them in S tier. Third on the list is a product that's been around for a while and is currently regaining popularity. This is the oral testosterone option, or testosterone undecanoate. There are currently 3 options on the market: Jatinzo, Tilando, and Kysotrex. Historically, insurance coverage has not been so easy to get for these products, and the newest product, Kysotrex, is a cash pay only option that helps bypass that hurdle. Oral testosterone capsules are shorter acting and are dosed twice daily. Oral testosterone capsules have been shown to be highly effective at controlling symptoms of low testosterone and have also been shown to have a significantly lower incidence of side effects such as erythrocytosis or an elevated blood count. Additionally, some smaller studies have shown less of a negative effect on fertility as they suppress LH and FSH less than the longer acting products such as testosterone injections. This is not guaranteed to prevent you from becoming infertile when on testosterone therapy, but it may be a better choice. The biggest disadvantage with these products, in my opinion, is that they have to be dosed twice daily. That's not a deal breaker, but for some people, it's not very manageable. Without insurance coverage, they can be pretty expensive compared to testosterone injections. That being said, they are relatively affordable, highly effective, and very, very safe. So I place them in A tier. The next option on the list is one that's very commonly used and has been around for a long time. And that's transdermal testosterone gels and creams. Transdermal testosterone gels and creams are very simple and easy to use. They typically come in either a packet or a pump and are applied once daily to the shoulders or thighs. Transdermal testosterone is extremely well studied and has been shown to be very safe. It's also shorter acting and tends to have less side effects such as erythrocytosis or the elevated blood count. Transdermal testosterone gels aren't particularly cheap, but they are commonly covered by insurance. The biggest downside I see with transdermal testosterone gel is that it often doesn't work. Men will be applying it daily, and they're not absorbing it through their skin, so when they come in to retest their testosterone level, they're still low. We try to increase the dosage, and it just doesn't work. And that's wasted time of men not feeling good. Men will also complain that they don't like keeping up with it daily, and they feel like the gel's messy. These may seem like minor inconveniences, but when you're choosing a therapy to use for the rest of your life potentially, it matters. The other downside to transdermal testosterone is the slight risk of transference or getting the gel on somebody else. If you have small children or a pregnant woman in the house, I'd suggest finding a different option. However, the risk of transference is actually very low. It's recommended you apply the gel first thing in the morning and then wash your hands thoroughly and place a shirt on after the gel has dried. I like these medications for their ease and simplicity of use, but I don't like their unreliability. Therefore, I place them in B tier. Next on the list is intranasal testosterone gel. This is very similar to the transdermal gel, except it's applied into the nostril 3 times daily. Similar to the oral testosterone, these have been shown in small studies to have less of a negative effect on fertility due to the short-acting nature. The patients I've seen on intranasal testosterone gels have reported good symptom management. There's also a lower risk of side effects. The biggest complaint I hear with these is that it's annoying using it 3 times a day and that the gel will run down the back of your throat or give you a runny nose. Now, it's become very difficult to find this product and insurance coverage is extremely hard to get. Without insurance coverage, they're pretty expensive as well. We don't use these too often anymore. They're not very popular. I place them in C tier. Next on the list is a product that's actually very popular, testosterone pellets. These pellets are implanted into the hip and last anywhere between 3 to 6 months. Once implanted, they begin to slowly dissolve. They peak at around 3 weeks and then slowly taper from that point up to the next insertion. Patients generally like these because they don't have to keep up with the therapy. They come into the clinic every 3, 4, 6 months and have new pellets inserted. Their levels stay mostly stable after that, although typically by the time they come in for reinsertion, their testosterone has become low again. Many patients are actually experiencing symptoms of low testosterone by the time they return. The biggest downside with the pellets, in my opinion, is one, the price. It's not always covered by insurance, and they cost several $100s or more to pay out of pocket. I'm not crazy about the idea of having to come into the clinic quarterly to get a minor procedure done. With each procedure, there's some risk of complications such as bleeding, bruising, soreness, and infection. Although this is pretty uncommon, it's unpleasant if it does happen. While I'm not crazy about this option because of cost and the possible risk of complications, a lot of patients really love it. For that reason, I'll place it in B tier. Lastly, we'll be discussing products that help maintain fertility and increase your natural production of testosterone. Generally, none of these products are quite as effective as just giving you testosterone. However, if you want to try to preserve your natural testicular function or your fertility, these are really the best choice. One of the older, most commonly used products on this list is clomiphene. Clomiphene is an FDA-approved drug that's used off-label for the treatment of low testosterone and infertility in men. It blocks estrogen receptors in the brain and stimulates the pituitary gland to send more signal to the testicles for more sperm and testosterone production. In my experience, it's pretty effective at increasing testosterone levels and even improving fertility. That being said, it's not very effective at improving symptoms. I'd say most of the men I treat either feel a little bit better, not much different, or occasionally even worse. In which case, we discontinue the medication and things usually just go back to normal. The biggest side effect I see with this medication is elevated estrogen levels. It's not a terribly big deal. As I said, it can be controlled pretty easily by giving you a medication to lower your estrogen. This medication can also cause mood changes and most severely some vision changes that can become permanent if the medication is not stopped quickly. It's a very rare side effect, but it does occur occasionally. Clomid is currently reasonably priced and can be found for about $70 or $80 a month. While I appreciate clomiphene's ability to improve fertility and natural testosterone production, I'm not crazy about the side effects and I'm not impressed with its ability to improve symptoms of low testosterone. Therefore, I place it in C tier. Next on the list is a sister of the drug clomiphene known as N-clomiphene. Clomiphene has two isomers, zooclomiphene and N-clomiphene. Zooclomiphene is thought to be associated with more of the side effects that are seen with clomiphene, and N-clomiphene is the part that's supposed to be helpful. You can now get the isolated isomer N-clomiphene in a pill by itself from a compounding pharmacy. Small studies have shown less side effects compared to clomiphene and just as much improvement in testosterone production and fertility. N-clomiphene is similarly priced to Clomid and can be found typically around $70 or $80 a month from a compounding pharmacy. My opinion is if the medication is just as effective as Clomid, virtually the same price, and possibly has less side effects, that's the one I'd prefer. Therefore, I place N-clomiphene in B tier. Next on the list is a highly effective medication known as HCG or human chorionic gonadotropin. HCG is a preferred medication for improving fertility, testosterone, and is pretty effective at controlling symptoms of low testosterone. It needs to be injected about 3 times per week as a standalone therapy and can be injected subcutaneously at home. The main side effect I see with HCG is an elevated estrogen level. The biggest downside with HCG is cost. Cost is constantly fluctuating, and currently, HCG standalone therapy would probably cost somewhere around $200 a month or more. HCG can also be combined with other testosterone products such as testosterone injections or any of the other testosterone formulations to help preserve testicular function and fertility. Again, there's no guarantee you'll remain fertile, but it's a little bit of an insurance policy. As a supplementary therapy, it's not quite as expensive, but it's still not cheap. If it wasn't for the price, HCG would be my top choice for medications that help preserve fertility. Aside from price, there's not a lot of downsides to HCG other than it just doesn't work quite as well as giving you testosterone. Therefore, I place it in B tier. Next on the list is testosterone boosters. These are supplements that can be purchased over the counter, are unregulated, and virtually untested. There's no evidence that they work, so I place them in F tier. Last on the list is lifestyle. Sleep, diet, exercise, and stress management. These are critical. No medication I give you can replace these. I place these in S tier. So that's it. That's all the medications I commonly use in my practice. There are a few other options on the market that just aren't used as commonly. Not that they're bad, they're just not as popular. If someone mentions these as an option, they're worth looking into. I just didn't cover them today. At any rate, I hope this was helpful. If you have any questions, please post them in the comments and I'll do my best to answer. Thanks for joining. Get strong, stay hard.